Like it or not, the senior and elderly population is vulnerable to negligence committed by medical professionals, nursing home and assisted living facilities, pharmaceutical and medical device companies, insurance companies, and everyday individuals and businesses. The Injured Senior Podcast is here to help. Steve Heisler is the creator of the National Injured Senior Law Center and has been advocating for seniors' rights for over 20 years. You have questions, and Steve Heisler has answers. This is the Injured Senior Podcast.
Ladies and gentlemen of the injured senior community, we have Dr. Cascone on today, who has been on the show twice before today. He is a board-certified infectious disease physician and is the medical director of several nursing homes in Southwest Missouri. Welcome back, Dr. Johnny. Is it still okay to call you Dr. Johnny?
Absolutely. Thank you, Steve, for having me back on.
Great. I'm so happy to have you. How you doing today?
I'm doing well, sir. Doing well. It's good to be here.
Well, it's good to have you. All right. So we're in the midst of a worldwide pandemic. You heard me talk about how COVID has disproportionately impacted the aging population. Why do you think generally this is the case?
Let me get some definitions out of the way, and then we'll talk about why this pandemic is disproportionately affecting the elderly. COVID-19 is the name of the disease caused by the virus SARS coronavirus 2. And coronaviruses are well known to mankind. They're the cause of the common cold. This particular coronavirus that has caused this pandemic is unique. It's related to a pandemic that we had in 2002, the SARS pandemic, and it's the first cousin of that coronavirus that caused SARS in 2002. You pointed out data from China in February of 2020, where it talked about if you were 80 plus years of age, your risk of dying from COVID-19 was 15%. If you compare that to a 20-year-old who gets COVID-19, their risk of dying is 0.2%. So you have this exponentially greater risk of death in the elderly. Why that is, we don't know for sure. It has to do probably with a number of factors. One, the elderly have more comorbid conditions, okay? High blood pressure, heart disease, diabetes, obesity. And those comorbid conditions increase your risk of having a bad outcome from COVID-19. The other issue that probably is going to pan out to be the case is that the SARS coronavirus 2, the way it infects us is it attaches to a receptor on our cell called ACE2, ACE2. And it's kind of like a lock and key mechanism. The virus attaches to that lock, opens up the door, if you will, and then the virus gains entry within the cells of our body and causes the disease, COVID-19. As we get older, that receptor probably goes up, is in a higher concentration in our elderly population compared to the younger population. And that may have something to do with it in terms of why this infection is, why the elderly are most vulnerable to death from this pandemic. But it's a striking characteristic of this pandemic.
Do you think it's more because of the receptor issue or more because of the comorbidities?
I'm not for sure. I don't think anybody knows for sure. It may be a combination of both. It's more likely it's going to be a combination of both, if not something else that comes up in terms of a risk factor. But this is not unique to this pandemic. Some pandemics, for instance, if you look back at the 1918 Spanish flu pandemic, the mortality for that pandemic affected the younger group, 35-year-olds. The mortality rate is much higher in the elderly with this pandemic than it is in the younger population. The risk factors or the reasons why are probably a combination of the multiple comorbidities that the elderly have compared to the younger population, as well as these concentrations or the concentration of the ACE2 receptor that's higher in the elderly.
If you had to maybe throw out a comorbidity that would put a senior at the highest risk for COVID, is there maybe one that maybe jumps out as far as, a pre-existing condition that might be especially harmful to seniors as far as COVID is concerned?
Well, in terms of risk factors, in general, hypertension and obesity, as well as cardiovascular disease, tend to be the most prominent risk factors or comorbidities that puts one at risk for COVID-19 and a bad outcome from COVID-19. And you see those risk factors in a higher proportion in the elderly.
So, but is there one that might be more dangerous to an elderly person than any of the others?
I think those three are the most dangerous: hypertension, cardiovascular disease, and obesity. Okay,
got it. Now, most people in general who get COVID, and I'm just looking at statistics, basically only suffer a mild illness. I think it's like 81% of people who get COVID sustain a mild illness. Are the seniors and elderly that get COVID, are they more in the severe and critical illness category?
They tend to be symptomatic, and they tend to have more severe disease. If you look at, just as an example, let's say you have 100 people who are infected with this virus that causes COVID-19. They're infected with the SARS coronavirus 2. Of those 100 people, you can remove 50 of them because 50 of them are going to be completely asymptomatic, and that's primarily going to be the younger people. Okay. Now that leaves you with 50 left over that are going to be symptomatic, which is primarily going to be the older population. Of those 50, as you said, approximately 15 to 20% of those 50 people are going to have severe and critical illness. And primarily the ones having severe and critical illness are going to be our elderly population.
Are those the 20% that are seniors and elderly? Now, the ones that don't die from COVID, what are some of the lasting effects that they can expect to have as a result of having contracted COVID?
Yes. So this is kind of, the term for this is called post-COVID syndrome, or long haulers is the other term that's being used for patients who suffered this infection and are having residual symptoms. We don't know for sure because, frankly, it's a little bit early. Okay, it's only been this pandemic's less than a year old, and we're going to find out more clearly what the long-term effects are as time passes. But some of the symptoms that you see, over half of the patients who suffered COVID-19 will have fatigue, residual shortness of breath, and cough in close to 40% plus, joint pains, just kind of feeling under the weather. You have these residual effects, and if you look at patients with COVID-19, close to 40% of them 3 weeks later will have only 40% will return to baseline 3 weeks later, and that leaves a significant amount of people who, even within 3 weeks, are still not feeling back to normal. Other issues or other residual symptoms that can occur with COVID are brain fog, where you just have a cognitive issue where you can't think of things, you don't think as clearly, and just not. It's not a typical viral syndrome where you recover in about 5 to 7 days. It just kind of drags on the symptoms.
Dr. John, what about the patients, the elderly or senior patients that have to be intubated? Is that the post-COVID syndrome that you talked about? Are some of the lasting effects that you just discussed? Is that increased if you were intubated or maybe sedated, or something that was a little more intensive?
Yes. Well, once a patient gets intubated with COVID-19, the mortality starts to go up goes up significantly. Intubation with COVID-19 is kind of a last resort for us because it can cause or worsen the lung injury. And typically, intubation with COVID-19 tends to be a prolonged intubation, meaning they spend days, if not weeks, on the ventilator. And so not only do you have residual effects from the virus, this post-COVID syndrome with the brain fog and fatigue and shortness of breath, but patients are also at risk for what's called critical illness myopathy, meaning the prolonged ICU stay and the intubation causes the muscles to weaken and not reduce strength overall. So it's kind of a double whammy there in terms of affecting patients long term.
Thank you for that, Dr. John. Appreciate it. Now, if somebody wants to follow you or maybe get in touch with you, is there any social media that you have where they could find you on?
I'm on LinkedIn.
Okay, so they can find you on LinkedIn?
John Cascone, MD.
John Cascone, Cascone, MD.
Yes, sir.
Thanks again, Dr. Johnny. We're going to have you back again because we're going to have to talk about, I think we discussed earlier, Legionnaire's disease or urinary tract infection. So you are an encyclopedia for our listeners about infectious diseases. So thanks again, and we'll be talking to you soon, my good friend.
Thank you. Now, have a good day and stay well.
Injured senior and aging population community. Thanks for listening to today's episode. I want to again thank Dr. Johnny Cascone for appearing on today's show. Really, really good stuff about COVID-19. And I'm sure we can all breathe a sigh of relief when we hear that we might be rid of this, hopefully by the end of next year. So that's good news. If you love the Injured Senior podcast, we'd love for you to subscribe, rate, and give a review on iTunes. If you want to share your story on an upcoming show or have any suggestions or comments about the show that you want to talk to me about or share with me, please email me at Steve, Steve, at injuredseniorhotline.com. As you know, I answer all emails, so have at it. I'm looking forward to reading them. So until next time, I am so looking forward to next week's show. Stay safe, and I will talk to you then. Bye-bye, everybody.
Thanks for listening to the Injured Senior Podcast with Steve H. Heisler. If you enjoyed the podcast, please rate, subscribe, review, and share on Apple, Google, or wherever you get your podcasts. To find out more or to get help anytime, go to injuredseniorhotline.com or call 855-622-6530. We'll see you next time.